Hi, welcome back to the Healing Point Massage Therapy YouTube channel. I'm joined again with Liana, the owner of Healing Point Massage Therapy in St. Albert. After our last video, so many people wanted to know what manual osteopathic therapy is. So Liana agreed to come back and tell us all about her passion and what manual osteopathic therapy is. All right, I hear you have a quote for us today again.
Yes, I'd love to read that for you. So our bodies communicate to us clearly and specifically if we are willing to listen to them.
Wow.
Yeah, so we just have to to listen to our body, because that's the only way that we can communicate with our own is to listen.
I love that. I also have a statistic here. There are two types of manual osteopathic therapy in Canada. Type 1, which requires 4 years to obtain your degree, and Type 2 requires previous education in the field of massage therapy, chiropractic, physiotherapy, or acupuncturist before you can continue your education as a manual osteopathic therapist.
Yeah.
So is that what you have?
Yeah, so the type 2 one is the one that
Excellent.
Yeah.
So continuing your education so that you can deliver this therapy.
Yeah, from the massage therapy, just kind of curious of what I can do more and how I get to treat clients better. More.
Wonderful.
Yeah. Yeah, and then so, in class, while we're in class, I thought I shared to you. So the instructor kind of called me in as the body for the class, and I didn't tell anything about my foot pain on the right heel of my foot there. So he was working on the craniosacral area there of our class, and then he was working on her, and then suddenly just slowly releasing my foot pain on the right side, and I just couldn't talk. I was just pointing in the class that my foot is being treated right now. He's in my head, and then my foot is being treated, and then it's just never go back. So yay!
That's amazing.
That's amazing how everything is kind of connected, and it's interesting.
Wow, that's fascinating. So can you share with us what exactly manual osteopathic therapy is for our viewers?
Yeah, I'd love to share that to you. So it is a client-centered, holistic approach on that focuses on the relationship of structure of the body and the way it functions. So manual osteopathic therapy supports the body's ability to self-heal, and maintain health by using all hands-on manual techniques to check if the tissue is in the right place, on if it's there, whether if it's moving properly, and if it's moving properly, is the blood supply moving in and out properly. So that's kind of the basic to summarize that. So we're looking for biomechanics, the movement of joints, each joints there. Movement of fascia, like the fascial system that connects everything in the body. The fascia happens when you breathe. You making sure fascial system are getting enough blood supply, between tissues. Also, we check for movement of sutures of cranial bones. So all these little bones in our cranial moves a little. They have a little movement on its own, so we check on those movements as well. And then we check movement and location of the organs, and all these things we match the client's actual symptoms to what the client's body present now. Yeah, so a lot more deeper kind of understanding of what the body and then how all the system kind of connects to each other.
Wow, so everything is connected.
Yes, and we're all going to check that, and I'll be discussing more further with this video today. Yeah, so excited.
Excellent. So what happens during the treatment?
Yeah, so during the treatment, so we started with the assessment for sure. Usually we book 60 to 75 minutes for the first appointment. We start with the history taking. So we want to know the past accidents, surgeries, injury, even minor, major, anything that kind of have affected all these, even the little things that can remember, even the fall from a tree, that can definitely affect, you know, how your spine from then till now. And then if there's any medication that may affect outcome, you know, the outcome of the treatment. So now that we have, once we gather all that, now we have an idea what the client's body went through. So then we compare it to current assessment and observation. So now we're going to be assessing the client in the standing position, the seated position, lying. So we're going to check, is it even, like, is the client even, any asymmetrical area of the body, is the one leg shorter than the other, is the client leaning on one side, you know, is there any joint that being stuck or compressed on the one side or the other? So kind of the general posture, is the client, you know, a lot more like this, or, you know, does it have is it leaning towards one or the other? Yeah, so those kind of general assessment first. And then functional assessment also, we ask the client to move, right? Because we wanted to know what they can do, what their joints or shoulders, the neck movement, the shoulder, the hip movement. So we're going to check for, you know, we ask them to flex forward, you know, the side bend, you know, we check the range of motion of the neck, hip, shoulders, things like, you know, drop one leg or drop the one knee in there. So different things actually to assess the mechanical function of the client. And then we also go through specific assessment, so checking spinal alignment, any rotation, they're checking, you know, any curve or anything like that. So we also check organs, you know, with passive, kind of active movement of the organ. So with the passive, we check without, we just kind of listen to the organs. Kind of interesting stuff about for that. So we listen to the organ. We listen, how are they moving, kind of very well. We're just kind of to listen. Is it doing its movement? Is it happy? Is it a happy organ there? So, and then actively we check that organ if it's moving along the axis that it's supposed to move, you know, to do the movement there. So this active and passive assessment is true to all other tissues of the body. We check the muscle, the joint, the tendon, you know, ligament, kind of all this, the things that are moving in the body. We check each of them. And then, you know, and then we ask the client also to lay down on the table. You know, we check for the T lines. We call it T lines when we check the fascial lines and fascial restriction, which kind of checking subtle movement with the body, and how if there's any restriction throughout, you know, one side and then the other as well. And then we also check for, we call this PRM, or like vitality, because that's the fluid that's going in and out, you know, not out, sorry, just in through the body. We call it the primary respiratory mechanism. So through light touch on the cranial bones. So yeah, so we were able to listen to each movements of the cranial bone, and, you know, check each to assess the movement of the fluid that goes through our body. When you listen to those areas, you can even listen it to the hip, to the foot, and to the shoulder, and to our ribs there. So yeah, those are kind of the areas that we will listen and check and see, are they moving well, are they symmetrical, those little things as well. And then, you know, all of that assessment, we take all of that, you know, add together and then develop the treatment plan. So you know, from history, from what they can do to what the body's presenting. You know, for the active passive movement, you know, the organ, the craniosacral, for vitality point of view. So yeah, it's kind of a bit probably overwhelming, but yeah, so that's how body's kind of interesting. We just wanted to feel, to know what's the client is, what's going on with the body of the client, so we can understand them very well.
That's a very in-depth process to start.
Mm-hmm.
I love that.
Yeah.
Learn about the entire body before treating it.
And everything is kind of connected. Yeah.
Wonderful. So how does this benefit a client?
Yeah, so I just wanted to share you, there are like 4 principles of osteopathy that I'd really like to share, that the body is one unit. Like, it can be just a neck pain doesn't affect your lower body, right? So it's just everything, kind of like the motor vehicle accident that happened to you 5 years ago can have a hip pain or foot pain down the road too. Yeah, so this is the one unit. So then number 2 is the body is capable of self-regulation, self-healing, and health. That's what we're made kind of, right? So to self-heal. And then the third one is the structure and function. The structure, or the body structure, affects function, and the functionality of it can also affect the structure of their body. So it's kind of reciprocal. And then all of these all of these together can kind of affect to one whole kind of wellness, and bringing back the balance of the body. And if you're able to get that balance to your body, then you can heal, right? You can act as a one, kind of again being from no problem again, going back to kind of reversing all the symptoms, like from what you have now, and then back to like finding the area of the primary issue of your body. So that's kind of the benefit of this is we balance the body so that it can heal yourself, and then the nervous system just, if our client is so much in pain that it cannot self-heal, it's because the nervous system is in just too much going on, and it can't even function anymore. So we wanted to just try to, hey, slow down, right? Slow down the body, just nervous system, just relax that first with all, because the manual osteopathic therapy really focusing on the nervous system, and then try to say, hey, brain, stop the pain, right? Because everything is just really the nervous system telling us, hey, pain there, is because kind of the brain telling us there's a pain there, right? So it's really trying to normalize and just relaxes our nervous system to do that.
Wow. And does insurance cover this therapy?
Yes, so most insurance actually cover osteopathy, which is different from your massage, from your chiro or your physio. So it has a separate section there. And then for now, direct billing is not available, but hopefully in the future, when we have more manual osteopathic therapists there to practice. So that's
excellent. So you don't do direct billing, but we can come in and get the therapy and submit our receipts?
Yes,
Excellent.
Yes, we do that.
And what problems does it help solve?
Solve is chronic unresolved pain, arthritis, foot, ankle, hip pain, upper and lower back, sciatic issues, all that stuff. So hand, shoulder, elbow pain, headaches, migraines, concussion, tennis and golfer's elbow for those that's on the computer, carpal tunnel syndrome, any repetitive muscle injuries, right? And then postural problems, lots of that. So now, either to the work, due to pregnancy, sports injury, work strain, right? So all that as well. So as well as digestive issues. So urinary, respiratory, menstrual pain, all of that, because again, right, it's the whole thing.
Wow.
It's just going to affect, like muscle pain can, it's a wide range of that can benefit the clients, and pre and post pregnancy aches and pains and anything like so, spinal decompression or insomnia, sleep disturbance or energy issues as well, whiplash, jaw dysfunction, and so on. So from that thing that the chronic unresolved pain that you don't even know what's going on, why is it like it's been here for so long and getting So yeah, try this treatment, and this might be the one that's you needed, and just never
Excellent.
know.
That's
Yeah.
fascinating. I had no idea that my body was so interconnected.
Yes, that's why I love to just spread it out there. Every client that I treat, that like sharing it, that maybe they can try that as well.
I can see
Yeah.
why it's your passion.
Yes.
And so who can get manual osteopathic therapy?
Yeah, so if you're dealing with any injury or pain, and would like to be treated, yeah, book this treatment. Again, this might be the one that can help with that unresolved pain or issue that you have, and then
Okay.
you're like, what's going on? I've been to all my blood works are all okay. Sometimes things like that. So this may be all these interconnected, fascial restriction in your body that just need to be released, and and go from there. Let your body kind of self-heal from there. If we can just kind of rewire those areas of restriction in your body.
Excellent. So how often should I be getting manual osteopathic therapy?
Yeah, so usually I book the client once a week for 4 consecutive weeks, and that depends also on the client's response to the treatment. Sometimes after the second treatment, there's a lot of improvement already, and then so we kind of adjust from there. But it's kind of nice that you book that for the natural body's kind of restart. The weekly, and Monday is Monday, right? So every week you restart the body. So that's how we kind of booked a treatment, and usually go from there. They can have maintenance after the 4 weeks, or really depending on how the response of the clients to the treatment.
Excellent. That's great. Is manual osteopathic therapy safe?
Yes, it's it's a very, very gentle, non-invasive kind of treatment. It's all hands-on treatment. Sometimes if I work on the visceral, like the organs and the cranial, sometimes I just fall asleep there and I don't know. And so it's just very light. Sometimes I have to really, for the clients that are really curious, so I always explain to them what I'm doing, especially when your hands is just there. You thought we're not doing anything, but we're listening a lot. We're taking so much information by just putting our hands to your head. There's so much strain, cranial strain, that we're trying to get what's going on with this body here. So then I actually have a cranial kind of sample in the clinic, so that hey, I'm working on that color of that bone there, that color green there in your temporal bone is kind of restricted, so that they have idea, right? So it's a really safe, it's very light, all hands on. Try this treatment.
Our body is talking,
Yes.
and Liana is listening.
Yes. Oh, I love that.
So what happens after the treatment is over?
So again, even how gentle this treatment is, because of all the changes, and then we're affecting the nervous system as well, you can be sore after treatment. You can feel tired after the treatment, and sometimes it can take up to 3 days from your body to adjust and actually feel the difference from the day of the treatment. Especially, and then we always have to tell them, hydration, right? And rest is recommended after.
Wonderful. And who can provide this treatment?
So manual osteopathic therapists here in Canada, there's a type 1 and type 2, right? The MOT, manual osteopathic therapist. I am a type 2 myself, and so come see me for this manual osteopathic therapy, and we'll hopefully unlock your body's self-healing capability, right? So
Wow.
that's I always say to people, like if your body is not been able to heal and it's just been going on pain, we have to do, we can try this treatment, see if there's something else that you have no idea that can, we can take the restriction from other part of your body that's affecting a knee pain, a foot pain. So yeah, it's really, from the assessment of the body, it's just sometimes mind-blowing how they all kind of connected. And even the clients as well, they kind of, I don't know how that can be connected, but they get so interested with their body. They tend to listen to their own after the treatment, and they become in tune with their body, which is so important to listen to your own, right? So like, yeah, it's, you come see me for manual osteopathic therapy and you know what I mean after.
Excellent. Well, I'm convinced. Why don't you share with our viewers how they can reach out to you and get an appointment for manual osteopathic therapy?
Yeah, so you can always call us our clinic number 780-569-3838, or you can even book online, healingpointmassage.ca.
Wonderful. Well, thank you so much. I know we learned so much, and we're all going to make appointments to get our body listened to. That's all the time that we have today, but if you enjoyed today's content, please hit like. And if you want to keep hearing more great topics from Leanna on the Healing Point Massage channel here on YouTube, just hit subscribe and you'll get notified every time we have a new video come out. And until then,
thank you.
Take care.
Thanks so much.